Well, for some reaction into the President's address, we're now joined by the Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal, Professor Mosa Moshabela. Thank you so much indeed for joining us, Prof. Welcome to the program.
Thank you so much. Greetings, Peter, and to the viewers.
All right, so for us lay people trying to understand what the President said, we've gone to level 3, but there doesn't seem to be much of a shift, I guess, in terms of the lockdown hours and maybe the sale of alcohol. Do you think that this is enough given the situation that we're in?
Peter, I do think that what we are seeing now, the changes we received tonight, are actually adequate to help us to curb the transmission that is currently happening. I think it's a matter of emphasis. I do think that this is what we had hoped the last time when the President addressed us, to actually take us to alert level 3 with these restrictions instead of alert level 2. However, it is still timely. In my view, I do think that the President could have emphasized a few things. That struggle here that the President has is in terms of ensuring adherence. The government doesn't really have a clear strategy on ensuring adherence to these measures. But if we all adhered to the current measures, we would be able to see improvement in terms of the trajectory of the pandemic currently. So for me, I think that the measures are adequate. It's just a matter of making sure that we can comply and adhere, and also the government can play its part and the citizens can play their part.
All right. And I think you've given the key word there, adherence. And one of the things that we do very badly in this country is compliance and adherence. So what will make it different with these new restrictions?
Yeah, no, for me, I think in terms of the current restrictions, if you think about it, we want to make sure that there's enough hospital spaces. And in terms of hospital spaces, we tend to lean on reducing alcohol consumption and accidents and demand for hospital bed. So that seems to be partly taken care of. And the rest of it really depends on the participation of citizens. The second part of it is that when we are at alert level 3, in general, we expect people to work from home. And I would have hoped that the President could emphasize the fact that employers and others need to encourage employees to work from home. And also, we needed to address the issue of schools. I do think that, if we go back to online, at least in tertiary institutions that we can do, but also in schools, we need to ensure that that happens. Alert level 3 allows us to take care of that. On the whole, we need to restrict movement. And in terms of interprovincial travel, we could emphasize it. Places like Gauteng tends to spill over into many provinces like Limpopo and Mpumalanga and others. So I just do think that we need to highlight the importance of adherence within the restrictions that we have currently. Because if we increase the restrictions beyond where they are currently, then we are going to start causing quite a bit of inconvenience.
So, Prof, you gave quite a list, and essentially what you were doing is giving an argument to the idea that this is not enough.
No, Peter, I do think that it's about emphasis. I think that within the restrictions we have, the President could have highlighted these kind of things that I'm referring to around borders, around workplaces and schools. But I worry that the things like variants, for example, are not addressed in the speech.
All right, so help us understand them. Perhaps we're not getting it. So are we saying that at alert level 3, interprovincial travel is not allowed?
No, it is allowed.
Okay.
But I think in terms of adherence, what we are trying to do is to restrict movement, Peter. And the emphasis then should be that because we are restricting movement, people then also need to lower their movements without necessarily preventing travel.
Okay, so what you're saying is that we're putting it in the hands of South Africans, and they haven't shown us before that they will comply and adhere. So if you have proof that your compliance levels with your public is low, shouldn't you then step up your interventions?
Yeah, you could, but I think that as the president opened the speech, he said that there are concerns that if we act too harshly, then we tend to restrict economic activity. And in a way, we're trying to walk that fine line. And for me, the way I'm looking at alert level 3 currently is that it's trying to be a balance between restricting movements to prevent disease spread, as well as allowing some economic activity. But we don't necessarily want all of the restrictions to be imposed by law, because then that means that it starts to violate the rights and the right to autonomy and to self-sufficiency for people. However, there is a responsibility that's involved in raising restrictions to this level to say that every individual now needs to recognize the seriousness of the pandemic currently and therefore lower their movements. Only essential movements needs to start to happen.
All right. And a key part of moving forward is the vaccination program. Do you think that enough is being done to pick up the pace and get it to a point where we start to see significant numbers of South Africans with needles in their arms?
Yeah, we do need to have more jabs in the arms as soon as possible. But I think some of the more recent challenges were beyond the control of the government. And I do hope that Aspen and Johnson & Johnson can really come through with the additional 2 million Johnson & Johnson doses that have been promised starting next week and until end of this month. And also that Pfizer can still come through with the doses that are promised. I do think indeed it's true that we are now seeing that the country is capable of increasing capacity. If we can increase capacity to around 150,000, as the president said, it will make a big difference in terms of coming closer to, kind of covering all the people that are at risk and starting to bring in new groups, for example, 50 plus and 40 plus, yes, may start to come in. But for now, I do think that we need to make sure that the vaccine doses starts to flow in so that there's no interruption at the vaccination site.
Do you think that there's room for Sputnik 5 and Sinopharm, perhaps, to come in much quicker?
Not much. If we think about the fact that we are locked into contracts that would basically cover 46 million people, this is like more than 75% of the population, then we don't really have much room to take on new contracts. Those two contracts, the 75%, the 46 million is covered with Pfizer and Johnson & Johnson. I think it is more for those two companies to be able to ensure that the vaccine doses are flowing into the country and they don't limit us, given the fact that we are locked into contracts with them. But outside of that, we don't have much room to maneuver.
All right. And then, we're hearing stories already that a lot of the hospitals are already full. So what do we do in the immediate next couple of weeks, for example, in terms of managing this pandemic? Because it is quite possible that if somebody gets sick, needs hospitalization, they might not get a bed this week and next week.
Yeah, I mean, it's sort of what I'm saying, that, what we need to do is make sure that we don't get infected, Peter. And the way you kind of limit chances of infection is to stay put, basically. And staying put means that we as citizens have to take it seriously. I personally don't expect that government should impose any further restrictions than what we have. But within the restrictions that we have, we need to make sure that we limit movement so that we can limit transmission of infections. We must not expect government to do everything and end up restricting every movement. That's not going to feel nice. But within the restrictions that we have, let's make sure that we disrupt infections by staying put.
But schooling, that could be revisited, in your view?
In my view, definitely schooling needs to be revisited. We've got school holidays coming up. People probably have plans. We need to restrict that kind of movement. We need to make sure that as much as possible through the 2 months to 3 months of this third wave, if we can do online schooling, we must definitely do it. And I don't necessarily think that the president needs to impose that. I think that the education sector needs to take it upon itself to make sure that that happens, because it has been allowed previously within alert level 3.
All right, Professor Moshabela, thank you so much indeed for joining us and for your insights this evening. Thanks for your time.
Thank you.